part lizard, part insect, and we've got a lot of stories of beings that are very alien in nature under the influence of psychedelic drugs.
Okay.
So, I mean, I don't know how much of that explains this. I don't think that the near-death experience and these are the same.
Right.
There may be some overlap in the dying process. There may be enough DMT release to give you a psychedelic-like response, perhaps in preparation for death. I don't have the answer to that, but it's not the same. It might be some, again, there may be some overlap, but it is not the same as the real near-death experience.
Okay, so let's stick to the relevance of the afterlife as a result of near-death experience. What do we do with that in terms of how it supports the fact that there is a supreme being? How do we put the two together? There was a debate at Wadsworth Theater in Los Angeles, California, February of this year, 2011, with, it was with two rabbis, David Wolfe and Rabbi Bradley Artson, and then with Christopher Hitchens and Sam Harris.
Ah, yes, yes. I didn't realize that was in 2011. I got that clip off
February.
of YouTube.
It's February 17th,
really? Okay.
2011.
Wow, that's pretty recent.
And it was with the by the American Jewish University, Wisdom Center for Continuing Education. There were some really interesting points about from the view of a reductionist or an atheist.
Well, yeah. Hitchens made that point. He says that, well, because if they're not, they didn't stay dead, therefore they weren't dead. Look, we define near-death experiences as not. It's called near-death for a reason. Hello. Okay. It's not called death. It's called near-death. Death occurs, when it's irreversible. Okay. Now, here's what happens. All right, when your heart stops and there's no longer blood pumping to your brain, your brain ceases electrical activity within 10 to 20 seconds, okay? Now, where does that mean there's no electricity? The entire cerebral cortex is electrically dead in 10 to 20 seconds. Now, your brainstem still has enough juice to keep you going, but cortex shuts down. Why does it shut down? Because if it continues to work, it's going to speed up autolysis. It's going to speed up, the brain will liquefy. If your brain continues to work when there's no blood pumping, it will eat itself very quickly. So it needs to shut down. Now, what that means when the cortex shuts down, that means no hearing, no smelling, no seeing, no nothing, no feeling, no nothing. You are locked in. Now, when people have these near-death experiences, they are not only reporting that they still have sensory stuff going on, but it's vivid. It's more vivid than normal, and it's right.
So the intellect remains intact?
Not just intact, consciousness. People report that they are looking like a fly on the wall. They're looking down at the people. I mean, I could literally talk for way more time than we have. I have so many stories. When I was at Botsford and throughout my practice, I get one of these stories at least once a month. But it was a lot more frequently when I was in the hospital. Okay, but these stories are very common. I remember one case where a woman was on the table. They were doing surgery on her. They lost her, and they were trying to resuscitate her, and the doctor who was trying to do the resuscitation panicked, and he started swearing really bad. And that happens. If you've ever done surgery, the surgeons tend to be pretty high-strung. Not all of them, but many that I've worked with tend to be like that. And he just started cussing and swearing, like, I'm not gonna blankety blank bop. And he was going on, and they got her back. It's like, wow. Well, after it was all over and they got her back, he says, do you talk to all your patients like that? He goes, what are you talking about? And then she said word for word everything that he'd said.
Wow.
It's like, you were supposed to be dead. The thing is that, if you don't have brain activity, and she was, the thing in this case, she was out for a long time. There was no heart pumping for over a minute with her. I mean, it was
and all that time she was experiencing
She heard
afterlife.
everything.
Wow.
But not only that, I mean, people come, I remember the one case, what's her name? It'll come to me, but actually we had Pamela
Reynolds.
Pam Reynolds. Yeah, that's a big case,
One of the most compelling examples of an out-of-body near-death experience is the case of Pam Reynolds. At age 35, Reynolds was diagnosed with a life-threatening brain aneurysm. Her only hope was to have a very unusual operation. In order to save her life, doctors would have to drain the blood out of Pam Reynolds' head. What's more, her body temperature would be lowered to 60 degrees, her heartbeat and breathing would stop completely, and her brain waves would be flattened. Doctors who perform this intense procedure have nicknamed it standstill because, for all intents and purposes, Pam Reynolds would be dead. But was she?
The process of death, scientifically, now is known to be a process and not a point in time. It starts with normal waking reality and ends up in irreversible death. During this process, the body dies at different rates. The problem we have as scientists and physicians is to determine when the brain is actually dead, i.e. when the person is actually dead.
In the case of Pam Reynolds, one of the surgeon's main concerns was seizure activity. To guard against this and other complications, Pam's brain and body were extensively instrumented and monitored, which makes what happened next even more intriguing.
Pam Reynolds had a very deep near-death experience at the time that she had documented no brainwave activity, no brainstem activity. So this eliminates the possibility that this was a seizure phenomenon, because during her experience, she had no seizure activity on the EEG. In addition, she had plugs in both of her ears, so she could not have physically heard what was being discussed in the operating room, and she could recall the accurate discussions that were going on at the time that she was having her experience.
Okay, I'm going in. Make it quick.
But perhaps the most compelling piece of evidence in the Reynolds case is the detail with which Pam was able to describe a particular surgical tool. During her out-of-body experience, Pam saw a tool which she would later say looked like an electric toothbrush with a dent in it. She also noticed that the tool had interchangeable blades. These were kept in something that looked like a socket wrench case. How could Pam Reynolds have described with such amazing accuracy the details of what took place in the operating room when she was supposedly dead?
Because in Pam Reynolds' case, they were fixing an aneurysm, and her brain was completely drained of blood. There were the EEG monitors, all of cortex. There was zero electrical activity in the cortex, and yet she described conversations that they were having, and she described the tools that were used on her during her surgery, including a bone saw that had just come out. Now, if somebody were working on me and they used a bone saw, I would think, I used to teach anatomy at Eastern, and I know what a bone saw looks like. A bone saw looks a lot like, back in those days, it looked like a Dremel with the saw on the end, with a circular saw on the end. That's what the bone saw. This bone saw that was used in her surgery was a new one that looked more like an electric toothbrush. She accurately described it and described the holder that it was in and everything, all right, while she was electrically out of it. And the experiences like this really confirm that these are not hallucinations. These are not events that are taking place within the skull. These people say that they're outside of their body, and because they're able to give objective evidence for that position, it confirms it. I mean, what are we supposed to say to that? How else are we going to respond to that? It's not like we only have a couple of these. We now have hundreds and hundreds. We have over 1,000 cases like this. Now, what's interesting, though, is that of the thousands of cases of near-death stories where people report these kinds of phenomena, we have hundreds where people have seen events outside of their body, okay? Now, of those hundreds, about 23% will go back and say, hey, you know what? When I was out of my body, I saw you in the cafeteria, and you were talking about such and such. Is that true? And in 23% of the cases, they find it's confirmed. It's confirmed that they really did go through this. And so when you look at these cases, these are people who are willing to go on record. I mean, it's no longer one case. This has exploded now, and it's impossible to be intellectually honest and to say that this isn't happening.
Okay.
We have to listen to the people that have had these experiences to get some idea. This is not something that, as scientists, we can credibly evaluate. We have no tools to go over there and come back. We can't record these things. We have to listen to what they say, and that's what we're left with. What's interesting is there are so many of them. We can get a picture based on all of these stories because they have a lot in common. It's like if you go to, if you go go to the Grand Canyon, everybody sees the same rocks. You might describe them a little differently, but doesn't matter what country you come from, you're all going to see this pretty much the same thing. You're just going to describe them from your vantage point. That's what near-death experiences are like. Everybody's describing the same kind of phenomena, only from their different vantage points.
Right.
Now, with regard to purpose, I am aware of many, and this is something that's really common, when sometimes people are given the choice to come back or not. That does happen. In my clinical experience with patients that I've had who've had this, most of them are not given a choice. But in people who are given a choice to come back, they come back for their family. One guy came back just because he wanted to tell his wife, guess what, you can't die. I just wanted to tell you that. And that's the only reason he came back, because he was so blown away by the fact that he kept going. But anyway, very often what God will tell people is that there are things that you need to do for me. That's why, and I don't ask me what he exactly means. I'm just passing on the message. That's what he says to a lot of people. Very many people, when they first get there, before they get the life review, he will say to them something like, what do you have to show me about your life? You know, what do you got to show me? And he says that a lot. I mean, that's a common thing that he says to a lot of people. What do you have to show me? The idea is that you're responsible to me. You're not your own. Everything about you has something to do with me. We're connected, and you are responsible to me. That is the God that people are meeting. He is not impersonal. He is not an alien. In fact, when people meet him, you get the idea that he's an extension of us almost. And I know that's somewhat blasphemous, but there is such a sense of connection that he doesn't feel alien in that regard. It's like, you know that he's been with you your whole life. You know that he's loved you your whole life. You know that everything you've gone through, every pain, every joy, he has been your constant companion, and you sense a family bond with him that is unparalleled. There is a sense of euphoria that no drug can touch. And everybody, I had one patient, for example, who just wanted to be dead again. I mean, that's the only reason he was seeing me, for depression, because he loved being dead. He loved that experience, and he hated his life on earth. And he said, I just want to be back there. I hate it here, and I want to be there, because that was the most incredible thing that ever happened to me, and life is bland compared to what I experienced there.
Yeah, I've actually heard that before too.
Yeah, I've had that.
Patients saying that.
Yeah, it is. Once you've experienced it, it's hard to come back. But the point is that idea of what's the point of it here is that he always he leaves them with that whole thing, and when they come back, what have you done to show me? And you've got things to learn and things to do for me. And that's always, it amazed me, because he seems to give that, it's like a going away present for everybody. Okay, by the way, you got stuff to do for me when you get back. But he's very much interested in our behavior, our life. That's the God that people are meeting. And that's, you know, I mean, to say anything more about this God, you would have to go to faith. I mean, you really have to take a look. For example, if you accept Christ as a spiritual authority, you take a look, what did he say here? I mean, that's, to learn more about this God, that's what you have to do. Okay, but you can't say anything more than that from a purely scientific perspective.
But you have those who are Christian, Islam, of the faith of Judaism. They all have that experience as well. Even atheists have that experience.
Yeah.